activity. So you actually breathe because of changes in your CO2 in your body, not because of changes in your oxygen. Oxygen and CO2 are required for all tissues of your body, whether we're talking about your liver, your brain, your heart. The only tissue that's not is the one that carries the oxygen, and that's blood. I think that kind of makes sense. We don't have any mitochondria in your blood. They just run off sugar. When you go into a hospital and you have surgery, my grandfather is 89 years old. He just had shoulder replacement surgery. I stayed with him right after surgery in Seattle. The nurse spent 3 minutes of his time explaining to him the importance of breathing to pump the blood back to his heart. Because not only did they put on a compression machine so that he would get venous return of his blood from his legs, but also is stressing the importance of moving his diaphragm to pump the blood from his organs back. Okay? If we don't have good blood flow, we can get such things as varicose veins and a whole host of other problems too, because that fluid has a pressure in it that weakens the valves of your veins over time. Our diaphragm has a specific action in our posture, which I'm going to talk about movement here at the end. It enhances digestion, and it also, the most important thing that we breathe is to maintain the acid-base balance of your body. So water is about a pH of about 7. We're just slightly more basic than that, of about 7.4. And your body has to run at a specific values, in terms of its function to function properly. And if we change this by making yourself more basic or more acidic, the function of your body changes dramatically. That's the overarching principle of today's lecture. So when I look at my medical textbooks, they say respiratory rate normally is 14 to 20 breaths per minute. It's barely audible, and that as you're sitting down, there's increased thoracic movement. The problem is that what normal is and what optimal is are two very different things. Okay? Normal is simply we take everybody that comes into the hospital, we check and see what their respiratory rate is, and then we'd say it's this, the average of that. What's optimal is actually around 6 breaths per minute. And this is a rate, plus or minus 1 breath. So it's not like we all have to breathe at 6 breaths per minute. But if you're breathing at about 5 to 7 breaths per minute, when you're just sitting here resting, that is going to be a breath rate that will optimize the balance between your nervous system, your cardiovascular system, and your gastrointestinal system. Your body's communicating with itself all the time. And if one of the ways that it's communicating is too fast, then everything else in the chain is going to be off as well. And we know this because we basically study the function of breath at different rates and see how it affects people. It should be diaphragmatic. So when we're sitting here, and we're going to go through a breath inquiry to see how we're all breathing shortly in the presentation. But the diaphragm is this muscle. It's kind of like right about here. It sits right over your ribs, right, on top of your liver, right above your stomach, and it actually connects to your heart too. And it's this dome-shaped muscle. It's one of the coolest things to look at, kind of like a parachute, if you will. And what it does is it contracts, and it actually will push your belly out. Okay? And I think one of the interesting things about the way our society has kind of moved is that we're all afraid to have our bellies come out. We don't want to say, hey, I've got this belly here, I need to breathe properly. But if you watch a child breathe, its belly is moving in and out, in and out, in and out, because it doesn't care what its belly looks like. The other thing, too, that really I get kind of upset with, I guess you could say is a good word, is when people get really, really stressed, and stress is just building and building and building on you. And you might have a friend, and you're just like, hey, just breathe. They do this. just done is they've activated all of their upper respiratory muscles, their pecs, their lats, their scalenes, all these muscles up here in their neck, to pull their rib cage up rather than to have the diaphragm descend. And that increases, one, your sympathetic or fight or flight drive, so you are more anxious, and you've also just blown off more of your CO2, okay, which changes your acid-base chemistry and makes you even more anxious. So it's a vicious cycle, and I think that if we can help people understand to control their breath when these situations come on, they won't last as long. So, you know, anger is a normal emotion, however you want to look at it. But if you're in a faulty breathing pattern, staying in that breathing pattern and not having the freedom to leave that emotion would be a state of disease. So, you all have the Nijmegen questionnaire score, and this is the first step. Actually, let me back up. I will be, you guys keep this. I'm not collecting it. It's all for your own, personal, information. It's not for a research study or anything like that. It's mainly to help you bring awareness to some of the myriad of signs and symptoms that hyperventilation can cause. Back in the Civil War, when so many soldiers were getting wounded or injured or things like that, there were doctors describing all these signs and symptoms, and they couldn't figure out why this was happening. What was, the common link between, having chest pain and feeling tingling in your fingers, or, your feelings of anxiety, or being confused, or blurred vision. I mean, you've got an eye problem, and then you've got a heart problem, or you've got a GI problem, and then you've got a musculoskeletal problem. It's kind of like this different darts on a dartboard, and you're trying to figure out how they're all linked, and we finally figured that out. So, please fill this out to your best of your knowledge, and hopefully you can use it to kind of look at and also bring awareness to, what are some of the things that are linked with faulty breathing patterns. The other interesting thing that I'd like to mention is that when we think of hyperventilation, I think everyone thinks of someone who's doing this. Okay? The rate is really fast, it's audible, they're hyperventilating is, I guess, what you would think of. The interesting thing is that that's not necessarily true. And that by definition, it's the amount of CO2 that you're breathing out. And so you could have been in a state of hyperventilation for quite some time, and you don't even know it, because your respiratory rate might be what's called normal, but when you measure how much CO2 you're actually breathing off, your body has changed its normal set point, and I'll explain that in a second. Again, if anybody has any questions throughout this, please feel free that they can, ask questions or anything like that. So here's kind of an example of one of the things I'm talking about. So the oxygen intake is restricted, so I'm going to hold my breath. And what's just happened is the amount of CO2 that I've exhaled has dropped. And the amount of oxygen, or the CO2 that's been produced, because my cells are still having to live, right? My cells are still breathing, even though I'm not. I get this dilation in my blood vessels, okay? And I have adequate blood flow to my brain. There's cerebral circulation, I get vasodilation, all these things. But if I'm in excessive breathing, and the amount of CO2 that I'm exhaling is greater than the amount that I'm producing, I've now constricted the blood vessel. And so I think that it's probably easy to see that high blood pressure, the whole host of signs and symptoms with restricted blood flow, the cold hands, the cold feet, a lot of things like that can be found in just changing